That's
Thank you, Chair, and hello again, Minister. As you well know, we are currently doing a study on caregivers in our committee. And one of the concerns that we've heard again and again from families and caregivers is that they're still feeling there's a lack of support for them and for the mental health and well-being of the children and of the caregiver themselves. And it's especially concerning when they're dealing with veterans who have PTSD. We're hearing a lot about how they're modifying their behavior, trying to be supportive, but they don't know how to support people well with PTSD. They're doing the best that they can, but they certainly don't receive any training from Veterans Affairs to support them, to help their families. So now we've got caregivers, often partners that are dealing with children that are frustrated and exhausted. They're exhausted, and in some cases, they're not able to work as much, sometimes not at all, because they're supporting this person who is really, really struggling. So I'm just wondering, we know that there's the caregiver recognition benefit, but this is not enough for, especially for partners who are now unable to earn a living because of the reality that they are living in their own home and dealing with those mental health support. So I'm just wondering, will VAC step up and start to support family members with actual resources, therapy, and supports to address the issues that the veterans are facing in their family?
Well, Rachel, as you're, I know, or Ms. Blaney, I'm sure you're fully aware that we have done that, and you're one that pushed hard for this, and you mentioned the caregiver recognition benefit, which is so vitally important, and it has to help some. But of course, there's always more to do. But the caregiver recognition benefit puts over $12,500 tax-free to the caregiver, so that's helpful. But of course, we're always open to more options that will make it better for veterans and veterans' families. That's what we're about, and that's why we have the committee, and that's why we have so many roundtables to listen. And I fully agree with you. Anything more that we can do within the mandate, I would be very open to see happen.